Voss Speros here, Greek on a Medicare. If Medicare's all Greek to you, you're in luck. I'm Greek. So the question today is, what is the most overhyped Medicare Advantage benefits the seniors should be wary of? This is a tough one because there's a lot of benefits mixed in that seniors should be wary of. Yes and no, because there's a lot of things that help people. One thing that is the network. They should be wary of the networks. Supplement plans don't have networks. It's great. PPO plans are in and out of network. I think what I feel is that when they're going to a provider, the benefits they'd have as an Advantage plan, the in-network benefits keep their costs down. So seniors keep their costs down by having an Advantage plan. They don't pay monthly for it usually, and they pay a minimal copayment for service at the time of service. So providers, depending on the provider type, I'm just going to throw out a couple: skilled nursing, home health, wound care, and home things like that. Get a higher reimbursement rate from straight Medicare. So they're going to come at you and say your Advantage plan's garbage. So be weary of what providers are telling you about your plan. If they're not a Medicare certified agent, an insurance broker like us that do this day in and day out and work with people and find plans that work best for them out of the hundreds of plans and options available, then them telling you your plan is garbage because you can get more benefits going back to original Medicare. Well, be weary of that. Be wary of providers telling you that, no, don't do that. You need to go back to original Medicare. Just real quick, if you're 90 days out of the hospital or skilled nursing, you can't apply for a supplemental plan. You get denied. So that if you go back to original Medicare, you have to pay that 20% cost share Medicare doesn't cover. How much does a hospital cost? How much does physical therapy cost? How much do doctors cost? It's a lot when it's not a managed copayment. So be weary of those benefits. The benefits that keep the cost down for beneficiaries on the plan are sometimes not good for the provider because the provider gets paid more on the other route. So is the provider really looking out for your best interest? The more benefits? No, skilled nursing is 20 days regardless. Advantage pays 20 days, supplement pays 20 days. They're in and out in 20 days. Home health, you get 8 visits. Basically 8 visits. Wound care can bill Advantage. Everybody can bill Advantage. So be weary about providers telling you that Advantage plans are garbage. If you have any questions, give us a call. We'll have a broker come out to you and help you review your plan to make sure you're on the right one for your current needs. Have a good night.